dépendra de sa détermination et celle de son équipe et l'efficacité de leur action dans la durée. Ils ont tous les moyens dont ils ont besoin du point de vue légal, car la nouvelle agence, la NADEC, a le statut légal d'organisme autonome, de par la loi, contrairement à la NATRESA, qui était une parastatale sans autonomie claire. De plus, la NADEC, comme on peut le lire à la section 8E, 2 et 4 de la loi, aura comme fonction et pouvoir la réduction de l'offre avec interface directe avec les forces de l'ordre, les douanes, la Financial Intelligence Unit et les partenaires internationaux. D'autant plus, le Premier ministre l'a nommé tsar. Donc ce n'est pas donné à tout le monde, n'est-ce pas? Je dois souligner, Madame la Présidente, qu'avec la NADEC, la lutte contre la drogue devient une volonté politique importante sous l'égide même du bureau du Premier ministre, contrairement à la NATRESA qui opérait au ministère de la Santé. Monsieur Le Tan, notre pont vers l'avenir dépend donc dorénavant beaucoup sur vous et sur votre équipe. Mais vous connaissant et ayant travaillé avec vous, je suis confiant qu'ensemble, comme l'a dit le Premier ministre adjoint, M. Béranger, nous réussirons.
Address me, not the stranger.
Thank you. Madame la Présidente.
Thank you.
Madame la Présidente, la loi prévoit que la NADEC aura comme objectif principal la prévention, le traitement, la réhabilitation et le contrôle de l'offre, contrairement à la NATRESA qui faisait seulement le traitement la réhabilitation des usagers de drogue. Je l'ai toujours dit que l'usager de la drogue, ainsi que plusieurs de mes collègues cet après-midi, est une personne en souffrance plutôt qu'un simple délinquant. Comme député de l'opposition, j'ai bien des fois personnellement accompagné mes mandants pour leur admission au centre de désintoxication Frangipane à Beaubassin, sur demande de leurs parents. Le docteur Djagrou, qui était en charge, et même par la suite son successeur, était toujours prêt à aider. Ils ont beaucoup aidé. En parlant de traitement et de son renforcement, et là je pense au programme de distribution de la méthadone, M. Sam Le Tan était présent lors de la réunion au Ward 4 à Port-Louis, un dimanche matin, il y a environ 2 mois de cela, durant laquelle les problèmes de la distribution de ces doses fut expliqué, cause des problèmes aux habitants du quartier, surtout l'école Raoul-Rivette qui se trouve dans le coin. J'espère qu'on arrivera à trouver une solution dans la durée à ce problème et qui sera dans l'intérêt de tous les partis, car notre manifeste électoral, à la page 55, est clair dessus. Elle stipule de revoir le programme de la distribution de la méthadone. Fin de citation. La drogue est aujourd'hui un problème de santé publique, de sécurité nationale et de cohésion sociale, menant même à des problèmes économiques. Comme ministre du Transport, je fais souvent face aux problématiques des chauffeurs sous l'influence de la drogue, que cela soit dans les transports publics ou en privé. Je peux vous dire que d'ores et déjà, la loi sera dorénavant plus sévère envers ce genre de chauffeurs. Madame la Présidente, la loi menant à la création de la NADEC marque une rupture, un mot que le docteur Navin Ramgoolam utilise souvent, mais maintenant une réalité en matière de combat contre la drogue. Je disais une rupture fondamentale avec l'approche antérieure, c'est-à-dire une combinaison de méthodes, donc une approche holistique. Donc l'équipe qui sera constituée par le tandem Sam Le Tan et le Dr Suleiman aura donc dans ce projet de loi NADEC à l'approche holistique un organe central à la fois stratégique, opérationnel et transversal avec plusieurs divisions spécialisées pertinentes. Madame la Présidente, en guise de conclusion, la prévalence croissante de la toxicomanie à Maurice, en particulier chez les jeunes, exige une action urgente et globale pour protéger la seule ressource précieuse de notre État insulaire, le capital humain. La création de la NADEC comble de manière renforcée le vide qu'avait laissé le démantèlement de la NATRESA dans notre stratégie nationale de lutte contre ce problème grave. Nous allons travailler avec sincérité afin de protéger nos jeunes et de construire le pont vers l'avenir. Ma dernière ligne, cet après-midi, est celle de feu Pape François, décédé hier, lors de son passage chez nous en 2019, comme rapporté par les journaux locaux et internationaux, par exemple le Figaro, du 9 septembre 2019, qui a comme titre, et je cite, « À Maurice, le pape s'inquiète des jeunes tombant dans la drogue. » Fin de citation. Quant à moi, je suis sûr que Dieu nous accompagnera, car beaucoup de monde prie pour le succès de la NADEC, sauf les malfaiteurs. Que Dieu nous aide. Merci.
Merci, Monsieur le ministre. Merci, Monsieur le ministre. Monsieur le ministre Bagouane.
Merci, Madame la Présidente. Madame la Présidente, j'ai eu de nombreuses occasions de participer à des débats dans cette Chambre. Mais je dois vous dire d'emblée qu'il me semble que ce projet de loi est de loin le plus crucial pour notre pays dans la situation actuelle. Madame la Présidente, je tiens à remercier le Premier ministre pour son engagement, ainsi que le Premier ministre adjoint qui a consacré beaucoup de son temps et de son énergie à ce dossier d'importance nationale. Je salue aussi également le travail rigoureux de l'équipe de l'Attorney General et de l'Attorney General's Office. Grâce à un effort collectif, nous sommes aujourd'hui réunis autour de ce projet de loi. Je dis, Madame la Présidente, ce n'est pas le politicien ou le ministre qui intervient, encore moins un sociologue ou un addictologue. C'est simplement un observateur attentif de la société mauricienne depuis plus de 40 ans qui vous adresse la parole. C'est un père et un grand-père témoins de la lente dégradation sociale affectant principalement la jeunesse qui se tient debout devant vous aujourd'hui, Madame la Présidente. De nombreux orateurs avant moi sont intervenus pour dénoncer les liens incestueux entre les ténors de l'ancien gouvernement et la mafia de la drogue. Ils ont longuement démontré que sans la complicité tacite des autres sphères du pouvoir, une telle prolifération n'aurait pas été possible. Beaucoup a déjà été dit dans cette auguste assemblée sur ce drame quotidien qui brise des vies, désintègre des familles, détruit la jeunesse à Maurice et à Rodrigue. Dans chaque dépendance, il y a la douleur insurmontable d'une mère qui a déjà pleuré toutes les larmes de son corps, d'un père impuissant de ne pouvoir ou de n'avoir pu sauver un enfant happé par le poison. Et nous avons vécu, et moi j'ai vécu ce drame depuis plus de 40 ans, dans ma circonscription et ailleurs. Il y a des rêves fauchés, des potentiels anéantis et des avenirs confisqués. Attention, Madame la Présidente, ne croyons surtout pas que cela n'arrive qu'aux autres. La drogue s'est infiltrée partout, dans nos quartiers, nos écoles primaires, nos collèges, à l'université, dans les bureaux et jusqu'à nos foyers, dans nos foyers. Cette escalade sans précédent du trafic de la drogue est ravageuse. Elle affecte la performance à l'école, pousse à la déscolarisation, à la violence, à la prostitution, au vol, aux crimes crapuleux et provoque des accidents parfois mortels. Elle se nourrit de la précarité, creuse les inégalités, gangrène notre tissu social. Et qu'on ne se trompe pas, la drogue ne connaît ni religion, ni caste, ni couche sociale, ni délimitation géographique. Elle touche tout le monde. C'est pourquoi je pense que cette prolifération exponentielle de la drogue a altéré l'ADN du businessman mauricien et de la jeunesse mauricienne. Je dis peut-être certains businessmen. En effet, Madame la Présidente, combien de businessmen se sont laissés tenter par des gros coups d'argent facile? Nous en avons été témoins. Pour beaucoup, la drogue est devenue un moyen rapide de s'enrichir, et même si c'est au prix des vies brisées et des familles détruites. Cette prolifération exponentielle du trafic a aussi profondément modifié l'ADN de notre jeunesse. Une culture où l'effort recule et où l'argent facile devient modèle. Tout cela pour vous dire, Madame la Présidente, que les spécialistes de la question considèrent que le trafic de drogue et ses implications sont loin plus graves que la drogue elle-même. Car le drug money, l'argent qui circule dans l'ombre, dont personne ne connaît vraiment l'ampleur, on ignore combien il rapporte chaque jour, mais on en voit les effets. Cet argent sale corrompt des hommes d'affaires, des jeunes en quête d'ascension rapide et infiltre des sphères politiques. Ici comme ailleurs, il sape les fondations de notre démocratie, fragilise le socle de notre système judiciaire et menace l'état de droit. Madame la Présidente, ce que je vous dis aujourd'hui, je ne dis pas à la légère. Durant les premières années de ma carrière, entamée en 83, et vous étiez là, j'ai vu ici même, de mes propres yeux, des dérives graves, des élus partissant avec la mafia de la drogue. Certains barons reçus ici dans la galerie des invités, ici, nous avons été témoins. Certains ont cru, à un certain moment, pouvoir nous faire taire par intimidation. Combien de barons de la drogue nous avons vus dans les années 83, 84, 85, dans le couloir de cette auguste assemblée, tolérés par le gouvernement de la drogue. Madame la Présidente, parmi tous les crimes qui minent notre République, qu'ils soient économiques, financiers, institutionnels ou environnementaux, le crime lié à la drogue les dépasse tous par son ampleur, par son ostracité et les conséquences qu'elle entraîne. Ce n'est sans doute le dossier le plus grave auquel ce gouvernement est confronté. Et maintenant, la vraie question se pose. Que peut faire ce pays? Que peut faire notre population? Que peuvent faire les familles mauriciennes pour sauver notre jeunesse et à travers elle, l'avenir même de notre nation? Alors, Madame la Présidente, la National Agency for Drug Control, la NADEC, ne sera pas une agence d'observation. Avec un conseil stratégique fort, elle coordonnera la riposte nationale sur tous les fronts: prévention, traitement, réhabilitation et réduction de l'offre. C'est en soi une avancée majeure. Je pense que les membres de la Commission, les autorités, les médecins, les travailleurs sociaux, tous réalisent qu'aucun département, qu'aucune autorité seule ne peut combattre ce fléau, vu la dimension qu'il a prise. D'où le but clair de la NADEC: mettre fin à la dispersion des responsabilités et mener une lutte intégrée, evidence-based, humaine et déterminée contre ce fléau. Pour répondre à ce fléau, pour sauver notre jeunesse, pour sauver ce pays, il nous faut d'abord comprendre les facteurs qui permettent à ce trafic de proliférer. Le premier phénomène, c'est celui de la marginalisation et l'accroissement des inégalités. Les inégalités n'encouragent ni l'inclusion, ni la cohésion. Au contraire, Elle favorise l'exclusion des groupes, de sous-groupes, qui deviennent les premières cibles des viviers des trafiquants. Deuxièmement, l'absence de méritocratie à tous les niveaux crée une société à 2, voire 3 vitesses. La méritocratie qui représente le fruit, le résultat d'efforts fournis par l'obtention d'un diplôme ou d'une spécialisation, ne doit pas être qu'un mot creux, une formule pour faire joli. Elle doit redevenir une réalité. L'injustice sociale exacerbe les factures. Troisièmement, Madame la Présidente, l'incontournable rôle de l'école. Nous venons tout juste de vivre les assises de l'éducation, pilotées par mon collègue, l'honorable Ganga Prasad. Et le constat est clair. La République a besoin d'une éducation véritablement inclusive, participative, où chacun retrouve sa place selon ses capacités. Personne ne doit rester acquis. Personne ne doit être abandonné sur le bord du chemin. Quatrièmement, Madame la Présidente, l'expression d'un esprit sain dans un corps sain n'a jamais été aussi pertinente. Le sport ne se résume ni à une compétition, ni à une élection au sein d'une fédération, ni à ceux qui arrivent en tête. Le sport est un mode de vie, un vecteur de santé physique et mentale, un outil de discipline, de résilience et d'inclusion sociale. Et cette culture du bien-être doit être encouragée dès la petite enfance, dès le pré-primaire. Le sport est un allié précieux pour une société en bonne santé. Cinquièmement, Madame la Présidente, nous avons besoin d'une véritable révolution culturelle. Une culture nationale, vivante, qui nous accompagne au quotidien dans notre transformation individuelle et collective. La culture, c'est une quête. La quête de ce qui est beau, de ce qui élève, de ce qui fait le sens. Notre ambition en tant que nation doit être à la hauteur de ce potentiel. Créer les conditions d'un véritable éveil artistique dès le plus jeune âge. Parce que nous croyons que chaque enfant porte en lui un talent qui nous demande à s'exprimer. Et c'est ce talent qu'il nous faut nourrir, encourager et valoriser. Car derrière chaque passion, il s'agisse de devenir un bon guitariste, un peintre, un comédien ou un artisan, se cache une ambition. Et l'ambition, lorsqu'elle est accompagnée, encadrée par les parents, les enseignants, la société tout entière pousse à progresser et à contribuer demain au progrès du pays. Enfin, Madame la Présidente, et pas des moindres, parlons de la famille. Oui, les parents ont un rôle essentiel à jouer. Mais pour assumer cette responsabilité, encore faut-il qu'ils disposent d'un minimum de stabilité. On ne peut pas exiger l'engagement parental dans un contexte de précarité, d'insécurité ou de logement indigne. Encourager la responsabilité parentale, c'est aussi créer un environnement favorable, emploi stable, logement décent, sécurité dans le quartier. C'est cet équilibre qui permet aux familles de remplir le rôle pleinement. Aujourd'hui, une autre réalité à ne pas négliger, jeunes et moins jeunes, passent plus de temps connectés à un écran qu'au contact du réel. Où sont passés les moments familiaux, les parties de foot dans les quartiers, les balades à vélo, les cueillettes de jambon ou de goyaves de Chine entre amis. C'était ça, c'est les liens. Aujourd'hui, on est connected, comme on dit, mais pas united. Je fais un appel aux parents. Parlez à vos enfants. Si vous voyez que quelque chose ne tourne pas rond, demandez de l'aide. Madame la Présidente, le vrai problème, c'est que nous refusons encore de considérer la drogue pour ce qu'elle est, une crime organisée, alimentée par plusieurs millions de dollars. Plus nous tardons à agir à la racine, plus nous laissons le champ libre aux trafiquants pour prendre de l'avance se structurer, prospérer sans le moindre scrupule. Des descentes policières, oui, elles sont nécessaires. Reconquérir les quartiers, devenus des bazars à ciel ouvert de substances illicites. Nous avons vu que la répression seule ne fonctionne pas. Confier exclusivement ce combat aux forces de l'ordre, c'est entretenir un système où le marché reste florissant, les prix élevés et la prolifération garantie. L'argent de la drogue sert d'abord à alimenter le mécanisme de corruption des agents de contrôle du trafic. Il faut dire que la tentation est omniprésente au vu des sommes impliquées. Il faut un changement de paradigme. Une réponse efficace passe par une approche intégrée. Prévention, traitement, reconstruction, accompagnement. C'est le cœur du mandat de la NADEC. Madame la Présidente, alors l'heure est à l'action, avec courage. Je me tiens devant vous aujourd'hui pour défendre non pas simplement un texte législatif, mais un tournant audacieux dans notre guerre contre les drogues. Pour mener à bien sa mission, la NADEC sera structurée autour de 6 départements spécialisés dans la stratégie de réhabilitation, de la sensibilisation publique à la lutte contre le VIH-Sida et l'hépatite C, jusqu'à la réduction de l'offre via une coordination resserrée entre la police, les douanes, les FAIU et les partenaires internationaux. Hélas, Madame la Présidente, l'une des grandes erreurs, c'est de croire que la drogue est uniquement une question d'ordre public. Non, c'est d'abord une question de santé publique. N'oublions pas que les usagers de drogue ont besoin de suivi médical, de soutien psychologique, de réinsertion sociale. C'est en ce sens que le Treatment and Rehabilitation Services Division de la NADEC, en collaboration avec le ministère de la Santé, les ONG et les partenaires privés, assurera un suivi personnalisé, des traitements basés sur des preuves scientifiques, une réinsertion par l'emploi, des formations aux compétences de vie et une dignité retrouvée aux personnes en voie de rétablissement. Donc, une réponse profondément humaine, pas de place à la marginalisation. Les personnes dépendantes seront traitées, accompagnées, réhabilitées et insérées. La Prevention and Public Awareness Division aura un rôle central. Campagne nationale, ateliers, programmes dans les écoles, les lieux de travail et surtout un programme familial de prévention. La lutte passe aussi par l'encadrement des plus vulnérables. Un travail de proximité est prévu avec les ONG, les chefs religieux et les médias. Chaque département aura un mandat clair, des indicateurs de performance et des synergies définies avec des partenaires et des ministères, dont la nôtre, le ministère de l'Environnement. Et pour que cette machine fonctionne, place un véritable centre de commandement. À la tête de la NADEC, un Drug Control Board, aux commandes stratégiques, et au sommet, une commission nationale de contrôle présidée par le Premier ministre, assisté du député Prime Minister, comprenant l'Attorney General et des ministres, dont moi-même, Rodrigue, il sera aussi dignement représenté. Enfin, la société civile est au cœur de cette réforme. 6 membres, avec voix au chapitre, seront nommés au sein du Drug Control Board. En somme, Madame la Présidente, cette lutte ne pourra être menée sans ceux engagés en première ligne. Je saisis donc l'occasion pour me rendre un vibrant hommage à ces hommes et ces femmes, debout avec courage rare, sincères dans leur combat, au plus près de ceux qui luttent pour sortir de l'enfer. Et j'ai une pensée spéciale cet après-midi pour feu le père Robert Geoffrey, ancien curé de la paroisse de Sacré-Cœur Beaubassin, que j'ai côtoyé dans les années 85 à 90, qui a osé, avec beaucoup de courage, combattre les mafias de la drogue à cette époque. Il osait lui aussi confronter ses dealers, les réseaux, avec foi et droiture, et souvent aux dépens de sa vie. Lutter contre les réseaux criminels structurés représente l'un des enjeux les plus périlleux du combat anti-drogue, comme peut en témoigner l'infatigable Sam Loton. Choix logique à la présidence de l'agence, que nous saluons tous, et victime, lui il le sait, combien de menaces il a eu. Alors, Madame la Présidente, cette bataille, nous devons la mener ensemble, en tant que nation, en tant que peuple solidaire. Comme l'a dit le Premier ministre, we have to work together on this. À commencer à la maison, avec des valeurs, le respect, l'écoute et l'attention. Ce projet de loi, Madame la Présidente, n'est pas une réponse cosmétique. C'est un engagement total de ce gouvernement. Une mobilisation générale. Notre pays a trop souffert de la drogue et de ces drames silencieux et de ces familles brisées. Donnons, Madame la Présidente, à la population des raisons d'espérer. Avec cette loi, nous bâtissons une agence à la hauteur des défis urgents. Une agence moderne et résolument humaine. Une agence qui placera la vie et la dignité au cœur de son mandat. Et je souhaite bonne chance à toute l'équipe autour de Sam Loton, Dr Soliman et tout le personnel que cette organisation va recruter, et l'ensemble aussi des techniciens du gouvernement, des gens du State Law Office, pour que nous menons à bon port ce projet qui est très très important, non seulement pour maintenant, pour les générations à venir. Et je vous le dis, je souhaite bonne chance à toute l'équipe et je vous remercie.
Yes, Honourable Minister Housing.
Thank you very much, Madam Speaker. I have listened with a lot of interest to all those who have preceded me, and I have also read with a lot of interest all those who took part in the debate last week. I was not in Mauritius and I was not in the House. However, I thought it was important for me to peruse the words pronounced in this August Assembly by the Honourable Leader of the Opposition. But then again, I cannot but state the obvious. Once again, the Opposition, on such an important debate, one of them decides to pronounce a speech, the Honourable Leader of the Opposition. The second member of the Opposition, the ally of the MSM, decides not to say a word with regards to this historic piece of legislation. A first step towards sorting out a serious problem that our society is facing. Let the people outside of this assembly see it clearly. Let the cameras, let the eyes of the public look at those two empty seats. And what do those two empty seats show? They show the actual inability, incompetence of those two members, the parties they belong to. 10 years, they have not been able to propose anything with regards to sorting out the drug issues. On the contrary, let me not repeat again what all have said, Madam Speaker. We know exactly les Gabzi. We know what they have done, what they have not done, what they have refused to do. We know about the planting. We know about everything. But then there was no strategy. And the reason why there was no strategy on their part is because there was no will. And why there was no will, we know why there was no will. Certain people needed to be protected. Madam Speaker, I look at the speech of the Honourable Leader of the Opposition, and what do I read? And I read and I quote from what he said. I quote, comme c'est le cas dans plusieurs pays, nous avons décidé de traiter les usagers de drogue comme des patients qui sont ainsi sous des traitements par le ministère de la Santé. Dans la même foulée, Madame la Présidente, nous avions introduit l'utilisation du cannabis médical. Untrue. I have asked, when is it that cannabis medical is allowed to come to Mauritius? I'm not here attacking the Leader of the Opposition by saying that he's a liar. I'm not saying that. I'm only saying that what he said is not true. I don't want to go against standing orders. Whatever he said is not true, because fact, easy to be checked. You do not have cannabis medical in Mauritius, because in order to bring it into Mauritius, you need a prescription. And a prescription that is utilized is from abroad, because it has to be brought in here, but it's not accepted here. So what is this nonsense that he's making? What is he saying there? Total nonsense. Second nonsense. What does he say? La possession de drogue à usage personnel a été décriminalisée depuis 3 ans. Huge nonsense. I have been a lawyer for many, many years. I have spoken to friends in this August Assembly who are barristers who know that this is not true. Or maybe he does not understand what décriminaliser means. It makes it worse. Or maybe he is just saying things only to please his ears, or to please his masters, who were in the habit of fooling the people and coming up with words and words and words that had no sense whatsoever. So why do we have here a speech of the Honourable Leader of the Opposition that makes no sense? So what is his call to fame? Oh, his call to fame? We call for a commission d'enquête. But we all know of the results of the commission d'enquête. We've heard the Honourable Omia, who has spoken about of those who were mentioned as les acteurs principaux, même actrice of what Judge Lam Shang Lin found. We know. But then again, you see, let me pick up from where Honourable Subron, the Minister, Honourable Subron, stated, where he talked about 1971, and 1971 about Nixon. And he talks about at the time when there was the criminalization of drugs. At the time when drugs were criminalized in the United States of America, that created a new category of traffickers. See, because before it was criminalized, traffickers didn't exist. And it reminds me of the time of the prohibition. Yes. At the time when alcohol was prohibited, it created another category altogether. That was bootleggers. And what happened during the time of bootlegging? People made money. Why did they make money? Because, precisely, the demand was such as opposed to the supply, and it was made unlawfully or traded unlawfully. There was a whole traffic of alcohol that happened, and the price went up. People made money. It became a crime, and certain people benefited from that crime. And whereas others became victims of those criminals. The same thing happened. What happens when it becomes a traffic? When it becomes a traffic, people make money. And what has happened when you look at the statistics of Mauritius? Look at it. Look at the statistics of Mauritius. Number one, the number of people who are arrested for synthetic drugs is on the rise. Ever since 2015 onwards, on the rise. And people will be surprised that in the health departments of our country, the number of women who are admitted because of synthetic drugs is on the rise. You will be surprised that in certain categories, there are more women being admitted for synthetic drugs consumption than men. And you will see that year in, year out, the number of people becoming victims and falling to the ground, dying, losing their lives, losing their minds, destroying their health because of drugs is on the rise. And the government says, the Honourable Leader of the Opposition says that they have done well. But if this is doing well, God knows what is doing bad. Madam Speaker, the one way to break down traffic, there is only one way, is to remove the lure. What is it? The lure of money. If you break down the traffic, the fact that there is money in there, you hit the pocket of the trafficker, there will be no interest for the trafficker to continue being a trafficker. That's as simple as that. And when we look at the statistics, what do we see? We see that the statistics, those who are arrested the most are those who are consumers. Consumers of cannabis, consumers of synthetic drugs, and there is undoubtedly, all the documents I've read shows it, there is undoubtedly a direct correlation between the increase in the use of synthetic cannabinoids and the decrease in the use of cannabis. I see the correlation in all graphs, not only in Mauritius, even abroad. I know there are certain people who hold different views. But then again, we should take opportunity of this debate, which is a real step towards conquering the ailment that we are suffering from as a society. Take advantage of it. And let us not be concentrated on only one view, because there are views of many that we have to look at. And here I pick up onto what a lot of our friends today have said, Madam Speaker, decriminalization as opposed to legalization. I am not for legalization, but then again, let's stop for a minute and talk about decriminalization. I've read reports, several reports, and the question that I put, how many people today are behind bars in Mauritius simply for possessing a dose of drug? Question. Statistics in Mauritius do not tell us. The prison services do not tell us. How many are behind bars only for simple case of possession? And those are the questions that are put in various other jurisdictions. What are the benefits of decriminalization? I am not the one saying it, but I'm reading from a summary of various reports, ranging from the British Medical Association to the reports from the Senate in the United States, to reports of the United Nations, the World Health Organization, and a summary of all of it say those are the benefits of decriminalizing. Number one, reducing the number of people arrested. The idea here is not simply to arrest someone simply because he is smoking a joint, as we put it. This is not the whole idea. Reducing the number of people incarcerated, increasing uptake into drug treatment, that's the whole idea. Reducing criminal justice costs and redirecting resources from criminal justice to health systems. Allow me at this juncture to quote what the World Health Organization has stated on this issue of decriminalization. It says, I quote, countries should work towards developing policies and laws that decriminalize injection and other use of drugs, and thereby reduce incarceration. Countries should work towards developing policies and laws that decriminalize the use of clean needles and syringes. Countries should ban compulsory treatment for people who use and/or inject drugs. Human Rights Watch, what do they say? I quote, drug control policies that impose criminal penalties for personal drug use undermine basic human rights. Subjecting people to criminal sanctions for the personal use of drugs or for possession of drugs for personal use infringes on their autonomy and right to privacy. The criminalization of drug use has undermined the right to health. Government should rely instead on non-penal regulatory and public health policies. Now, those are issues that will have to be debated. The apex body that is being created through this legislation, they will be experts there, headed by experts, and they will have to find ways and means of analyzing all of this, because the people out there, Madam Speaker, want to find a solution. You see, when we come with this piece of legislation, we always have questions from members of the public. What is the purpose of this legislation? In what way will it help parents who are so traumatized? In what way will it help family members who have family members of their own, or friends or neighbors who are victims to drug trafficking and drug abuse? How do we help them? Number one, let us understand that those are victims, and we should see them as victims. Those are debates that should happen at the level of the apex body. And we should also take advantage of the situation to know that if we have used a system to fight drugs ever since the 1970s, let's look at the facts. Has it worked? No. The reason it will not work is because the money is alluring. Once, if there is money in there, it doesn't work. And let me try to conclude by referring to what I have seen with my own eyes. I have been to Geneva. At the time when I was Minister of Labour between 2010 and 2014, under the Prime Ministership of our Honourable Prime Minister now. In Geneva, I visited an ONG called Première Ligne. Première Ligne, Mr. Honourable Nasser knows very well. He was there at the time. Première Ligne runs a place called Quai Neuf. Quai Neuf is in the city center of Geneva. Quai 9, Q-U-A-I, 9. And there, what do they do? You see, Mauritius, the Honourable Prime Minister, introduced a very important element, which is the use of methadone. Very important. But Quai Neuf have gone a step further. They have a place where they have a register of all drug users, and there is an arrangement with the police that all those drug users, those who inject heroin, those who smoke cannabis, those who sniff, all type of drugs, all the drug users who are registered with Quai Neuf and who come to Quai Neuf to be administered the drugs are not arrested by the police. Because they come into an official stream of those who want to be recognized as patients who need a medical help. And they go there, they are assisted by medical doctors who welcome them. They pick a number. I saw it. I've been there. I've seen it. They pick a number. They wait for their turn. A medical doctor receives them, gives them a syringe, gives them cotton, gives them what they have, whatever they need. They sniff, inject, but it is done in a safe place. Prostitutes have said, I no longer am afraid now. I don't have to be hit or threatened in any way whatsoever, because I can go a step further in Geneva. If I want to find drugs for me, since I'm a patient, prostitutes have said, the government of the Canton de Genève provides it to me. Clean medical heroin, thereby killing the trade. You kill the trade, because where else, if the prostitute doesn't go to buy it from the drug dealer, the supplier, what happens? Because the government is providing clean heroin as a medication for that prostitute, for a woman who no longer has to rely sur le proxénète. This is liberation. This is strategy. And has it worked? I've read the statistics. Yes, law and order problems have gone down. Agression contre les femmes has gone down. Simple criminal behavior has gone down. And this has not increased the number of drug users, but on the contrary, it has managed to bring them in the normal stream of employability and work. So this is the whole idea. Either we dare to be different, or we simply say, let us use the same system that we have used since 1970s, believing that we can, in fact, be better by continuing to use the same system and expecting a different result. That doesn't work. Madam Speaker, be it Netherlands, they have used system. Portugal has come up with a system. Now England, and I'll conclude on that. In England, they have come up with one step further. There is now a heroin-assisted treatment. Heroin-assisted treatment. They have adopted the system in Geneva. And what are the results? In Middlesbrough, what has happened? They have found that, in actual fact, the objective has been reached, whereby government is killing the trade, drug trafficker. The money is being removed from their pockets. They're nullifying it. It's not lucrative anymore for a drug trafficker. They no longer want to be in that trade. They diversify. But as long as our people are protected. So this is what I humbly expect. This is what the government wants. It wants a debate for a proper solution, not a pretense as the previous government have done. Because while they were pretending, many have fallen along the way. I remember in this house how the former Minister of Health under the MSM regime, when there were questions being put to him as to what was the reason cause of death, because of people who were admitted for use of synthetic drugs, there were, as other members have said, other reasons were being, pulmonary edema, for example, was said. But every time they were hiding the truth. You can never find a solution if you don't face the reality head on. And this is what this government is doing. And this is what the Honourable Prime Minister and his team is doing. I say congratulations to him. Congratulations to the Deputy Prime Minister, the Attorney General. I know they've worked a lot on it. I know for a fact the effort that the officers of the State Law Office have put in making this. With regards to the issue of decriminalization, there are provisions under Section 28A of the Dangerous Drugs Act, but under rules and conditions. So, strict rules and conditions. There has not been legalization or decriminalization of medical cannabis. There has been no legalization of medical cannabis as such. And it is only available under strict conditions, but in practical terms, as I said, in practical terms. Can anyone in Mauritius tell me, okay, he has had a prescription that is admitted and agreed and he's brought it here? No. So, not far from us. Not far from us. And I'll have to really conclude on that. You know, in France, less than 0.3% of THC in CBD, it's called CBD, okay, is legal and it's sold off the street. Why? Because it is not something that is dangerous to society. So either we embrace solutions that are there, or we try to use the same approach. I say it again. Now, it has never been a solution to use the same approach when, in fact, it has never produced solutions. Now, being hard, arresting, you'll end up arresting all consumers. We are here to treat consumers. And we should break down the attractiveness of this trade. Remove the money. And as I said, whenever there is no money, the drug trafficker will try to diversify and do something else. Maybe we'll get him to plant some potatoes, but he will not be into drugs because there'll be more money in potatoes.
Or mushrooms?
Or mushrooms. But then again, let's be very careful. We'll be very careful. Maybe certain mushrooms, we have to be very careful. But those are my observations, and I am very hopeful. And the people out there are hopeful that those who have now the responsibility of suggesting changes, directions under those agendas that they have, that it will be done, but we will dare to be different, and we will bring daring measures. Thank you.
Thank you very much. Yes, Honourable Prime Minister.
Madam Speaker,
don't think I'm in favour of mushrooms.
Sorry?
Don't think I'm in favour of mushrooms.
No.
But we haven't seen it yet in Mauritius.
I like it with my own.
Madam Speaker, as we reach the conclusion of the debate on the National Agency for Drug Control Bill, first of all, I want to thank all the members of this House for their participation and suggestions on this crucial piece of legislation. Some of the speeches were very high level. Some of them were opinions, like Honorable Mohammed. He expressed his opinion. Yes. And I want to thank all of them. I also wish to thank the many NGOs and members of the public who expressed their views to us. This bill indeed marks a turning point in our nation's drug control strategy. I will address some of the concerns that have been expressed, including inter alia the centralization of power. We must remember, Madam Speaker, that the drug crisis in Mauritius is complex and multidimensional. We need a balanced, multi-pronged approach, if anything else. And this bill provides a framework for prevention, treatment, and care, but also rehabilitation, accountability, not just drug control. Let me turn to some specific points raised by honourable members, starting with the Honourable Leader of the Opposition, who is not here now. He raised the issue of having consultations on drafting of this bill. On this point, I must inform the House, I must inform him as well, that consultative meetings were held. The first one was held on the 17th of March of this year. There were representatives of 34 institutions and NGOs. The draft bill was presented to the participants, followed then after that by interactive actions. Proposals were taken into account and then we finalize the bill. Let me also remind him, the leader of the opposition, I know he's not here, but I'm doing as if he's there, that we're not following the practice of just rushing through the legislative process without listening to what others have to say, the NGOs, the civil society representatives. But I must also underline that over and above consultation, the Drug Control Board will also consist of representatives from relevant ministries and NGOs. And I must say the Office of the Attorney General, the State Law Office, they worked, they took on board all these suggestions that were made. The leader of the opposition also raised concerns about the future of NGOs like PILS in our new structure. Let me reassure the House, we value the NGOs as vital partners, especially in the areas of HIV/AIDS. We have to look at not only harm reduction, but community integration. And I've talked to Mr. Maybe we need to put him there, Mr. Ryder. Maybe he will be interested to be part of this, I don't know. The SADC, he's always ready to help. That is the point. The NADEC is not here to replace them, but to ensure coordination among relevant stakeholders and empower them under a unified national strategy. Their work will continue, but with more support, not less. The Honourable Leader of the Opposition has also asked whether NADEC will be carrying out drug seizures. I thought the bill was clear. I suppose the Leader of the Opposition does not realize, as the Deputy Prime Minister rightly pointed out, this bill is not just about seizures and repression. It is also about rehabilitation, about the treatment of victims of the drug barons. The bill is very clear, I thought. The National Agency for Drug Control would be a coordinating and monitoring body. One of its main functions is to coordinate and facilitate efforts at a national level towards the implementation of a national drug control master plan, the National Action Plan, and with HIV/AIDS and all those control strategy. Drug seizure falls under the purview of the police and customs, anti-narcotics section of the MRA. Drug seizure is not the business of the NADC. It's for the police, the customs, MRA to deal with that. The Honourable Leader of the Opposition has also raised the issue of real-time monitoring system. The National Agency for Drug Control Bill provides for the introduction of a real-time monitoring system to modernize the treatment of drug use disorders by putting technology at the center of care. This centralized, digitalized plan will track patients, track their progress in real time, will cover referrals, treatment, relapse, follow-up care, bringing in together all the healthcare providers, as well as the NGOs and the other correctional services. The system will aim at improving continuity of care, reducing service duplication. Very often we see that, and supporting evidence-based decision. It must be evidence-based. We cannot say just because we think something, we need the evidence. It will also strengthen the National Drug Observatory's ability to monitor outcomes and address gaps, offering a more transparent, coordinated, and effective response to drug dependence. Madam Speaker, with regard to the question whether the definition of drugs under Section 7B of the bill includes precursor chemicals, I wish to inform the House that this is already catered for under the Dangerous Drug Act, under the 4th schedule. However, under NADEC's mandate, the Supply Reduction and Coordination Division will work in close collaboration with law enforcement to monitor, regulate, intercept trafficking and misuse of precursor chemicals. The Leader of the Opposition has also expressed skepticism regarding methadone maintenance. He referred to it as another form of dependency. I was really surprised. I don't know where he gets all these ideas. We must not confuse treatment with abandonment. Methadone, when properly administered, has been endorsed by the World Health Organization as the gold standard for opioid pharmacotherapy. Unlike illicit drugs, methadone is regulated. Its effects are predictable, allowing users a chance to reintegrate society, hold jobs, rebuild families, and live with dignity. But as I say, it must be properly administered. That is the point. Anything else, it's the same for any medicine. If you were to take 16 Panadols, the doctors will do, you'll get into a lot of trouble. You have to know the dose. You have to regulate. Of course, tapering and exit strategies are part of the long-term rehabilitation plan. But again, this must be guided by evidence and nothing else. Let me also highlight the WHO, what the WHO recommends. It says that the longer, I'm quoting, the longer a person stays on methadone, the better is the outcome, the final outcome. So we will stay guided by science and evidence-based practices and international recommendations. We shouldn't play with the lives of people just for political gain or for political convenience. The real mistake, what they did when they came to power, was halting methadone programs abruptly in 2015. They thought they knew. I don't know, they don't read, they don't consult doctors, but they think they know. And they said, no, we must stop methadone. A mistake that costs lives. Dr. Omia knows what I'm referring to. It costs lives. People died because of this. And as we say, the proof of the pudding is in the eating. The former government, after a while, there was a doctor from Reunion Island which wrote an article which was published in the papers here to say this is a terrible mistake to stop methadone, but they ignored him. And then eventually, they had to swallow back what they had said, what they had done, and they had to restart quietly. Methadone was restarted. They realized, too late, they realized the mistake, and lives were lost because of the incompetence. Madam Speaker, the leader of the opposition also questioned why the National Agency for Drug Control should fall under the direct chairpersonship of the Prime Minister. Madam Speaker, I think the Deputy Prime Minister made it so clear that we must be unequivocal. This is not just about control. It is about a scourge that is destroying our country. The MSM has been criminally negligent. They have rubbed shoulders with the drug barons and have allowed them to operate. And not only that, we also know what they've done. They wanted to have the others, who were not necessarily the big drug barons, but who were in the business, to stop them. Planting and all those things was done so that the drug barons might be able to work, have the whole country for them. That is what they did. This government does not have the luxury about sourcing responsibility in the face of a national emergency. We are dealing with an epidemic that has touched every corner of this country, from cities to villages, every corner. This epidemic, addiction and trafficking has spiraled into a public health, security and social cohesion crisis. We have to ensure that the immunity that the drug barons had enjoyed is over. It will not happen. This is why it is me, the Prime Minister, who should lead it, together with the Deputy Prime Minister and the other ministers. I think there will be 16 ministers in all, I think you mentioned, and also NGOs, the police, ATSU, etc. Let us not forget that under the previous regimes, responsibility was scattered. I don't know whether it was done on purpose, it was diffused, it was scattered, nobody knew what they had to do. There was inaction, agencies were created, I don't know whether just to pay the boys, with no, and girls, with no clear purpose. Nothing was clear. Commissions, authorities were formed and ignored. The Commission of Inquiry, we saw what happened. And also known traffickers were allowed to walk free. This will not happen under this government. Never, never, never. Mean business, on va être, comme j'ai dit dans le passé, intransigeant, Madame la Présidente. The Honourable Leader of the Opposition also raised the issue of certificate of character to small drug users. We had said we ourselves have said we will relook at the issue of character certificates in entirety. I think it is not right, again it's an opinion, that a sword should hang upon somebody's head during his lifetime. We should relook at this. With regard to concerns relating to setting up of a drug control board and a National Drug Control Commission, I wish to inform the House that both instances have been clearly defined with complementary responsibilities. I will propose amendments at committee stage to delete Section 4 of the Act, re-lettering it, the lettograph accordingly as I've circulated. And it is not the function of the National Drug Control Commission, in fact, to collect and analyze data. This is provided for in Section 8(v)(5) as the function of the National Agency for Drug Control. Let me also address the issues raised by Honorable Lugovin. She proposed that the Minister of Tourism be added in the first schedule. I would like to point out that Section 3F provides for the Prime Minister to designate other ministers. The problem is we have 16. I know tourism is very important in this, but we have already 16 ministers plus the Prime Minister. But I have the possibility of co-opting the Minister of Tourism as when the need arises. Honorable Lugovin also raised the need to have a rapid test to allow the police to detect drugs. I wish to assure the House and the honorable member that the police will be provided with all the necessary equipment as we are reorganizing FSL, because we want quick results. At the moment, the honorable member is absolutely right. It's taking ages to get results. But how can you deal with drugs when you can't have the results? It has to be very, very fast. And this is what we are going to concentrate upon. With regards to the issues raised by Honorable Guérin pertaining to the role of the National Drug Secretariat and National Aid Secretariat, I wish to inform the House that the general role of the National Drug Secretariat will be taken over by the NEDC. However, the following responsibilities of the National Drug Secretariat will be integrated at the level of my office, that is, reporting to international institutions, namely the African Union and UNODC. It will act as a focal point to liaise with national focal points of other countries and the publication of quarterly and annual reports. As for the National AIDS Secretariat, its role will be taken over by the HIV/AIDS Prevention and Care Coordination Division of the agency. Regarding the proposal of Honorable Guérin for a referendum to be held for the legalization of cannabis, as the House is aware, provision is not made in the law for the organization of a referendum on such matters. And in any case, we have to be very careful with referendums. They have drawbacks. Very often it reduces the debate because the answer is either yes or no. It reduces the debate while this is a complex issue. Madam Speaker, amidst the ongoing national and international debates on drug policy, the distinction, what Honorable Shakil Mohammed has laid emphasis on depenalization, discriminalization, and legalization of cannabis for personal use is both significant, but it is a debate that we must have. Everybody has an opinion. Let me clarify the distinction in the definitions of depenalization and legalization. Depenalization means removing criminal penalties for possession and personal use of small amounts of cannabis. Depenalization means that while the substance remains illegal, it still is illegal. Individuals are not imprisoned or criminally prosecuted. Instead, they may receive warnings or fines or be referred to health services. A model which upholds depenalization aims to reduce pressure on the justice system and shift the focus towards the health and social support. While on the other hand, legalization means the use, possession, possibility, the cultivation and sale of cannabis under legal, under regulated conditions. Countries like Canada, I think you mentioned, Uruguay, California, the state of California, among others, have adopted this approach. They treat cannabis the same way they would treat alcohol or tobacco, with some safeguards. In Mauritius, cannabis is still listed on as a dangerous drug under the Dangerous Drugs Act. However, the introduction of the Drug Users Administrative Panel under Section 34(2) of this Act makes it evolution in our national drug control strategy, reflecting human rights-based approach for people who use drugs. The government remains firm on combating drug trafficking and protecting public health, and is increasingly open, but again, to evidence-based policies. There's room for dialogue. Even for cannabis, there's the debates. Some people say it is still dangerous. We have to look at the evidence. There is room for dialogue on whether depenalization combined with enhanced treatment services could offer a more effective and human strategy. But we have to debate. We cannot have a fix made up our mind now. We have to debate. With regard to the query raised by Honorable Edouard on the provision for Rodrigues to be represented at the Drug Central Board, I reflected on his suggestion. I spoke to the Deputy Prime Minister and the Attorney General, and I thank him because I think it's a valuable, what he said is very valid. And I also thank Honorable Henriette Mananbo. I was listening to your speech in my office to have commented on this. It is a very valid, there is a risk that from time to time, I think we will propose an amendment later on at committee stage at clause 3 to ensure that the Chief Commissioner of Rodrigues is represented on the Drug Control Board. It makes sense that Rodrigues is fully on board and all the time, instead of whenever may, as we said, may. Tailored initiatives will be implemented in Rodrigues, including school prevention programs, community outreach, and targeted media campaigns. Healthcare services will expand to include methadone treatment and real-time monitoring at the Rodrigues Regional Hospital. Harm reduction measures for HIV/AIDS and youth engagement programs will also be introduced. Madam Speaker, today we are making history. It shows, as the Deputy Prime Minister said, that unlike the MSM, we intend to take the bull by the horns. We will not shy away from the decisions we have to take. We are, through this legislation, establishing a modern, coordinated and compassionate system to address one of the greatest public health and security threats of our time. Let us rise above these trying to score political points and act decisively. Let us shield our youth, our families, our society from the odious and nefarious effects of drugs and drug traffickers. The National Agency for Drug Control positions Mauritius as the trailblazer in adopting a comprehensive and multi-sectoral approach to drug use, prevention, treatment, rehabilitation, harm reduction, and drug control. And we have chosen two well-known personalities, not anybody. Mr. Sam Lotan, former minister, is known for his determination to combat drug abuse. He was threatened in the past. I'm sure he's going to be threatened again. But he's well known for that. There's nothing that will make him move an inch. And his Dr. Faisal Soliman, who's a graduate of Hopkins University. I don't know how many of you know about Hopkins University. You don't get there if you're no good. That I can tell you for sure. His CV speaks for itself. And I think with these two people, I have no doubt that we are heading in the right direction as far as drug is concerned. With these words, Madam Speaker, I commend the bill to the House. Thank
you. Motion is seconded. Yes. The question is that the National Agency for Drug Control Bill number 6 of 2025 be read a second time. Those in favour say aye. Those against say no. The ayes have it. Now we will move.
Public Bills, Committee stage.
Yes. Please be seated.
Clause 1, short title. Clause 2, interpretation.
Question is that clauses 1 and 2 stand part of the bill. Those in favour say aye. Those against say no. The ayes have it.
Clause 3, National Drug Control Commission.
Yes. There is an amendment.
Yeah. Madam Speaker, I move that clause 3 be amended as per the amendment circulated.
Yes. Members have seen the amendment. The question is that clause 3 be amended as per amendment circulated. Those in favour say aye. Those against say no. The ayes have it. The question is that clause 3 as amended stands part of the bill. Those in favour say aye. Those against say no. The ayes have it.
Clause 4, Functions and Powers of National Drug Control Commission.
Again, Madam Speaker, I move that clause 4 be amended as per the amendment circulated.
The question is that clause 4 be amended as per amendment circulated. Those in favour say aye. Those against say no. The ayes have it. The question is that clause 4 as amended stands part of the bill. Those in favour say aye. Those against say no. The ayes have it.
Clause 5, National Agency for Drug Control. Clause 6, Divisions of NADC. Clause 7, Objects of NADC. Clause 8, Functions and Powers of NADC. Clause 9, Drug Control Board. Clause 10, Meetings of Board. Clause 11, Secretary to Board. Clause 12, Committees. Clause 13, Chief Executive Officer. Clause 14, Coordinator of Division.
The question is that clauses 5 to 14 stand part of the bill. Those in favour say aye. Those against say no. The ayes have it.
Clause 15, Other Staff of NADC. Clause 16, General Fund. Clause 17, Estimate of Income and Expenditure. Clause 18, Annual Report. Clause 19, Audit Report. Clause 20, Reporting on Activities and Operations of NADC. Clause 21, Protection from Liability. Clause 22, Execution of Deed, Contract or Check. Clause 23, Oath of Secrecy. Clause 24, Confidentiality. Clause 25, Protection of Whistleblowers. Clause 26, Regulations. Clause 27, Consequential Amendments. Clause 28, Commencement.
The question is that clauses 15 to 28 stand part of the bill. Those in favour say aye. Those against say no. Ayes have it.
The first schedule.
Question is that the first schedule stands part of the bill. Those in favour say aye. Those against say no. The ayes have it.
The second schedule.
The question is that the second schedule stands part of the bill. Those in favour say aye. Those against say no. The ayes have it.
Title and enacting clause.
Question is that the title and enacting clause stand part of the bill. Those in favour say aye. Those against say no. The ayes have it. The question is that I do report to the House that the National Agency for Drug Control Bill number 6 of 2025 has passed the committee stage with amendments. Those in favour say aye. Those against say no. The ayes have it. Yes. Please resume your seats. Honourable members, I have to report to the House that the National Agency for Drug Control Bill number 6 of 2025 has passed the committee stage with amendments.
Public Bills, third reading.
Honourable Prime Minister.
Madam Speaker, I beg to move that the National Agency for Drug Control Bill number 6 of 2025 be read a third time and passed.
Motion needs to be seconded. Yes, Mr. Bagwan, yes. You will then, I'm putting the question. Sorry. Question is that the National Agency for Drug Control Bill be read the third time and pass. Those in favour say aye, those against say no. The ayes have it. And Honourable Prime Minister, adjournment.
Madam Speaker, I beg to move for the adjournment of the House to Tuesday, the 6th of May, 2025 at 11:30 a.m.
The 6th of May, okay. The question, it has to be seconded. I needed the motion to be, I need the motion to be seconded. The question is that the House be adjourned to Tuesday, the 6th of May at 11:30. Those in favour say aye, those against say no. The ayes have it. The House stands adjourned. I have one member who wants to intervene. Mr. Ramkalawan. Yes.
Madam Speaker, my request is addressed to the Honourable Minister of Land and Transport. Will the Minister kindly investigate into the number of taxis operating in the locality of Queen Victoria, whereby my constituents have complained that despite adequate taxi licenses having been allocated, few are actually operational, causing prejudice to the inhabitants who have only taxis as means of public transport. Please consider.
Yes. Certainly, Madam Speaker, I will certainly ask the NLTA to conduct an inquiry and take remedial measures as needed.
Yes. Mr. Bichuk. Yes.
My request to the Honourable Minister of Agro-Industry, can the Minister please look into the backlog in the number of people who have applied for land conversion, which is taking months and months, and people complain because very often they have bank loans which have been approved, which lapse because they haven't received the land conversion.
I take on board, Madam Speaker, what my honourable friend is saying, but this is also a matter that has to be properly scrutinized. Also, when we talk of land conversion, we have to make sure the process is being done as should be. But I take on board what you've suggested.
Thank you, Minister. We're done. Thank you.